I want to call something cheesy. Okay, so it's a title which I hope makes you think and is somehow a bit cryptic. This is a patient. I'll tell you the history of the patient later, but first I want to just show you the images, and then I'll tell you exactly what this patient was all about. Okay, so you can see that the patient has an enlarged left ventricle. You can measure the diameter of the left ventricle here. 63, remember, everything that is above maybe 52, 53 millimeters is suspicious of dilatation. He was a fairly small young man, so this is certainly dilated. We have mitral regurgitation. The aortic valve looks quite nice. Okay. If you look closely, you can actually see that the aortic valve does not open all the way towards the wall, and that there seems to be abbreviated opening of the aortic valve, which is probably caused by reduced flow across the aortic valve. It's also understandable why the patient has reduced left ventricular flow across the aortic valve, because he has poor left ventricular function. So I'm not going to ask this question. This is probably much too easy. Okay. Next, I'll show you the 4-chamber view. Okay. The patient has a pacemaker, or a lead at least, in the right ventricle. Again, let's just measure the size of the left ventricle. 63, that fits nicely to what we measured in the peristernal long axis view. You can nicely also appreciate that the mitral valve is not opening very much. Certainly not due to mitral stenosis, but probably more to the fact that he has myopathic opening, again, as a result of low flow across the aortic valve. Prominent trabeculations here in the right ventricle. Okay. Those are just some studies we did, and I'll explain you later why we did them. But my question to you now is, do you notice anything peculiar about this case? Okay, he has mitral regurgitation. Well, the diagnosis here is cardiomyopathy. It's dilated cardiomyopathy, reduced left ventricular function in the setting of a dilated left ventricle. Okay, I'll just show you another image. Very poor left ventricular function. Okay, so now I'm going to ask you a question. Okay. What form of cardiomyopathy do you see? Okay, I'll close and show you the results. 38% of you say it's non-compaction. 54% say it's just simple, plain old dilated cardiomyopathy. 8% say it's hypertrophic cardiomyopathy, and no one thinks it's restrictive cardiomyopathy. Well, I would say both. Those who said it's non-compaction and dilated cardiomyopathy and hypertrophic cardiomyopathy are somehow right. Now I'll tell you the story of this patient. The story of the patient is, it's a fairly young patient. He's 45 years old, and his father died of sudden cardiac death at a young age. His brother died 3 years ago of sudden cardiac death, and his uncle died also of sudden cardiac death. And he fainted 5 times until he finally came to the attention of the cardiologist. An echocardiogram was performed, and this is his echocardiogram. So what do we learn from this history? Well, what we learn is that he has some form of genetic cardiomyopathy. And if we look very closely, what we see is we see a left ventricle which is not only dilated, but we also see that he has a very strongly trabeculated lateral wall of the left ventricle. With atypical views, you can see even more of this. I'll show you right here. This is very strongly trabeculated. You have little sinusoid kind of areas here in the myocardium. And this is a two-chamber view. And this is very typical of non-compaction syndrome. So the myocardium looks very cheesy. Now, what is the isolated non-compaction syndrome? What is actually this disease all about? Well, we don't really exactly know everything about the disease. Again, this is a very atypical view where you can see how spongy the appearance of the left ventricle is. But these patients seem to have a genetic form of cardiomyopathy where the congenital compaction is disturbed, in the sense that we have residual little sinusoids and strongly trabeculated left ventricles. This is also a form of cardiomyopathy which has a probably worse prognosis than other forms of cardiomyopathy, and it also is often associated with sudden cardiac death and often rapid progression. Not only do these patients have cardiomyopathy very often, but we frequently also see other congenital defects and other abnormalities such as neuromuscular disorders in these patients. So very important to detect this problem. Why am I showing this case? Well, it's very, very important to know that this is a disease entity that you should be looking for, because it means that you have to also perform a family screening in these patients. It means that you also have to take a look at the family members, because they are also at increased risk of cardiomyopathy and sudden cardiac death. Now, not all patients have reduced left ventricular function. You can also have non-compaction syndrome in the setting of normal left ventricular function. But even these patients are at risk of developing cardiomyopathy sooner or later. Okay, so isolated left ventricular non-compaction is a genetic disease where you find hypertrabeculation, especially in the apical, lateral, and posterolateral region, where the myocardium has a very spongy appearance. Here's another example. Here you have a beautiful example of a non-compaction syndrome with a very spongy appearance again. So take a look closely at all patients who have sudden cardiac death.